As they say down under, g'day. Today I'd like to talk about something that's near and not very dear to my heart, and that's insurance. I just read the New York Times this morning, and uh, they say that there's millions of people are dropping out of Obamacare, that they're going to remain who knows what, uninsured, whatever the situation is. It's not a good one. It is not a good situation at all. Now, I'm not speaking for myself. I have Medicare because of my old age. I have great supplemental insurance that covers well through retirement. I also am 100% disabled through VA, so I have great veterans benefits. This does not apply to me, what I'm about to talk about. It applies to everyone else out there who doesn't have the opportunities to have the coverage that I have for their health care. I have cancer. I have an incurable cancer, multiple myeloma, one of those things that followed me home from Vietnam, as I've said before, through Agent Orange. Be that as it may, we have a situation today that is going to be just horrendous for a vast majority, and well, not a majority, a vast number of our fellow citizens in the United States. I cannot believe the difference between our country and others when it comes to Medicare. I shouldn't say Medicare, medical coverage. Ours is so expensive, it's actually out of sight. Today, as I see it, a person who does not have insurance has one alternative: die or live with a debilitating disease for how many years, who knows. This is not the way it should be under any circumstances. I'll give you an example. I recently had a shot, one shot for my bones, which are very weak. That shot, the charge was for that injection $10,173. One shot, $10,173. I have an MRI scheduled. That MRI has been approved to the tune of over $4,000. How is a person who is making a moderate income ever going to cover something like that? They will be in debt for the rest of their life. And that's only one shot, and I get 3 of those a year. That's $30,000 a year, if it doesn't go up. And by the way, it has gone up by $1,000 or more per year for the last 5 years for that shot that I just told you about. Same with MRIs. They've gone up. Hospitals, care has gone up. This doesn't cover my doctors, and I've got plenty of those. I've got cardiologists, urologists, rheumatologists, pulmonologists, internists, you name it, I've got it as a doctor. And all of those guys and women charge, and they charge their fees for their services. And those fees, if they're not covered, come out of an individual's pocket. Healthcare is a horrible situation. And what has happened? Congress has failed in their wisdom to allow subsidized health insurance, health subsidizing Obamacare. They've taken that away. So virtually they've taken away health care. They have literally taken away health care for millions and millions of people. Unbelievable. In 2016, a certain gentleman who was running for the presidency said and repeatedly promised, I'm going to get rid of Obamacare and replace it. Quote, we will immediately repeal and replace Obamacare, and we will do it very, very quickly. Boy, I'll tell you, he loves that very, very quickly. He also emphasized There's nobody more against Obamacare than me, unquote. His signature then became repeal and replace. What was it going to do? He was going to replace it, and it was going to be lower costs and premiums. There was going to be better coverage than Obamacare. There was going to be more competition among insurers, greater consumer choice, and it would protect people with pre-existing conditions. He later emphasized that because, of course, it's one of the key points of Obamacare is that we have pre-existing coverage. He also said he has a very competitive plan where the costs will come down and care will improve. It would be much better and would save money. Well, I don't know about you, but I have never seen any plan. As far as I know, there is not one that exists. It was not replaced. It did not bring down anything. In fact, costs have continued to rise. Money has not been saved by anybody, including the government, because of the rising costs. Even now, he says he's going to replace it with a much better health care. What? I don't see where it's at. Tell me, what are you going to do? If it's flawed, sure, it should be replaced. And yes, there are problems with it. No question about it. But don't take away the insurance that people have now and need and can afford with subsidies. Congress, get off your ass. Pass subsidized Obamacare at this point of time. We've got people who are dying, literally dying, because they don't have health insurance, because they can't afford to go to the hospital, that they're afraid to go to the hospital. They're afraid to go to an emergency room because they know they can't pay for it. Absurd. Congress, put up or shut up. President Trump, put up or shut up. I don't want to hear you say anything about repealing and replacing unless you're really going to do it and you have a plan. I mean, one that will work and will save money and do all of those things that you said it would. But you don't. Mr. Kennedy, sitting there saying, oh, don't worry, insurance is great. No, it's not. Insurance is not great. It's horrible. And don't tell me it is. And don't tell the public that it is. You're living in a Neverland. And that's about it for me for today. And I'll talk to you later. Thank you for listening and subscribe, of course.